Thank you very much. So I'm going to present some work on the early intervention for mental health in schools. And this is based on joint work with Tanya Lerea, Yosun Yoon, Ruth Gilbert, and Jess Dayton. And it's work that we conducted as part of the Children and Families Policy Research Unit. So adolescence is a critical period for young people's health, mental health, and well-being. We know that half of mental ill health starts by the age of 15, with 3/4 by the age of 24. And mental health disorders in adolescence have a wide range of impacts and implications, both during adolescence, but also beyond in adulthood. But when it comes to educational outcomes, there are well-established associations between emotional and behavioral problems during adolescence and poor academic attainment, as well as higher absenteeism and exclusions from school. So over the past few decades, we've seen a significant rise in mental health disorders among adolescents, and this has just been exacerbated by the COVID-19 pandemic. And these recent escalations in mental health issues have raised the interest of policymakers to embed early intervention support for mental health in schools and communities. And one example of that is a recent policy called the 2017 Green Paper that channels significant resources to mental health support in schools. So these type of area level approaches to support mental health and well-being, so by embedding them in schools and communities, have strong theoretical foundations, but there's also an empirical base to suggest that there may be a promising way forward. However, today there is still relatively limited evidence on the effectiveness and the cost effectiveness of these approaches. And that may not be so surprising because actually evaluating this type of area level intervention, mental health interventions, is actually very challenging. The first reason why it's so challenging is that they're usually and never, I think, implemented as part of randomized controlled trials. So there is a challenge to find a suitable comparator group for the areas that receive these programs. And a second challenge is around the data. These type of evaluations require a lot of data that is often doesn't necessarily exist. So in this study, we're essentially going to try to start filling this gap in the literature by evaluating the impact that funding an area level program to improve adolescent well-being and mental health has had on school outcomes of secondary school pupils in England. So this program is called HeadStart. And HeadStart was a 6-year program aimed at designing and implementing new interventions to promote the mental health, well-being, and resilience of adolescents. So in 2016, the National Lottery Community Fund formed 6 partnerships in 6 different local authorities: Blackpool, Cornwall, Hull, Kent, Newham, and Wolverhampton. And it essentially distributed about £10 million to each of those partnerships to design and implement new interventions to improve these outcomes, with the view that through mental health improvement, it would also improve school outcomes. So improve academic attainment, reduce absences and exclusions, which are going to be the outcomes that we look at in this study. So with this funding, each local authority was essentially relatively free to design and implement a range of interventions that they thought would best address the needs of their adolescent population. And we, on the next slide, I can give you, the next slide sort of gives you a little bit of a flavor of the types of interventions that those partnerships put in place. So the most frequent ones were targeted well-being interventions, such as peer-to-peer mentoring programs to improve resilience and goal-setting skills at school, followed by school staff training or supervision to spot signs of mental health issues or prevent mental health issues from getting worse, followed by more targeted well-being whole school well-being interventions again in schools. There were a couple of interventions that were more targeted to parents and care, but overall, as you can see from this graph, the majority of interventions were implemented in schools. So our goal in the study is to essentially estimate the effect of this funding to the area to design and implement the interventions that they thought would be most effective for their adolescent population. So just to be clear, we are not estimating the effect of actually receiving an intervention, of participating in an intervention, but what we are after remains still a very high policy relevance because, it's a key sort of parameter to estimate the returns from this funding. So now, as I said, the Head Start was implemented in 6 local authorities, and there are really no sort of obvious comparator local authority to these 6 partnerships. So to evaluate the impact of the funding, we're going to use an evaluation method called the synthetic control method, which essentially is a data-driven approach to build a synthetic control that best approximates the outcomes of the treated local authorities, so the local authorities that received the Head Start funding before they received the funding. So I'm not going to go into the details of, how we build this synthetic control group, but essentially you can think of it intuitively as a method that is going to look to assign each local authority that did not receive the funding a certain weight. And it will be the weighted average of the outcomes across these non-treated local authorities that will provide a counterfactual outcome for the local authorities that received the funding. So we're going to implement this method using administrative education data, so the National Pupil Database, which you will have heard already about today. And we're essentially going to use 10 years of data on secondary school pupils. So the years, 11 years of data, apologies. So the years between 2008-9 and 2015-16 form the pre-intervention period. And we have 3 years for 2016-17, 17-18, 18-19, which are the years that of data that we're going to look at to actually estimate the impact of Head Start. So in terms of outcomes, as I said, we're going to be looking at impacts on absences, exclusions, and attainment. So to implement the synthetic control method, we're going to aggregate the individual level data from the National Pupil Database to the local authority and academic year level. And so we're going to look at 2 outcomes measuring absences, which are going to be the average proportion of those sessions missed for either an authorized absence or an unauthorized absence in the local authority. For exclusions, we're going to have 2 measures as well. One, which is the average proportion of sessions missed because of a fixed term exclusion. And the second one is an indicator for, is essentially going to be the proportion of students who are ever excluded in an academic year in the local authority. And lastly, to measure attainment, we're looking at the proportion of pupils, year 11 pupils, who reach 5 GCSE, who obtain at least 5 GCSEs A star to C, which is, an indicator that has been used a lot as an indicator of good academic progress. All right, so now let's get on to the results. So first, a graphical visualization of the results, which I think will give you an intuition for how the synthetic control method works. So let's look at the left-hand side graph. On the x-axis, you have the academic years. On the y-axis, you have our outcome. Here, the proportion of sessions missed for authorized reasons. The green line, solid line, essentially plots these outcomes average across the 6 local authorities that received the Head Start funding. And the blue dashed line essentially plots these outcomes in our synthetic control. As you can see in the pre-intervention period, so up to 2015-16, the blue and the hard line are hardly distinguishable from each other, which means that actually our synthetic control does a really good job at mimicking the behavior of the Head Start, of the local authority that will later receive Head Start, of our treated units. Now looking at the intervention period, you can see that those two lines now start diverging. The green line is lower than the blue line, which would indicate that there is a reduction in absences among the Head Start units. However, this gap is relatively small and actually non-distinguishable from zero. Now, if we look at another outcome on the right-hand side, so same type of figure, but here the outcome is the fraction of pupils excluded in the local authority. We see that during the intervention period, there is more divergence between the treated units and the synthetic control, which would indicate that there is a larger reduction in exclusion rates among the Head Start partnerships, local authorities. So just to summarize our estimates across the 5 outcomes that we look at, here to give you a sense of magnitude, I'm actually showing the proportionate impacts relative to the mean of these outcomes in the pre-Head Start period. So as you can see, very little impacts on absences, those are the first 2 outcomes, also very little impact on attainment, the 5th outcome, but bigger impacts of Head Start on reducing exclusions. Now, when we run inference tests, for this method, there's actually only one impact that remains statistically significant at the 10%, which is a reduction in the fraction of pupils ever excluded in 2017 as a result of Head Start. All right, so I think in summary, my last slide. So in this study, we evaluate the impact of an area level intervention called HeadStart, which was aimed to increase the well-being of adolescents in England. We failed to find impacts on absences or attainments, but we do find a greater impact of this funding on reducing the exclusion rate in the local authorities that received that funding. However, we can only really find a statistically significant impact for the first year that the funding was in place. So combine these 2 findings might suggest that actually, these reductions in exclusions are perhaps not necessarily picking up a change in the behavior of the adolescents, but rather perhaps a change in the school culture or approach towards discipline and exclusions. Now, the fact that these impacts are not really sustained over time does indicate that there is perhaps a challenge there that needs to, be carefully considered so that these type of interventions can see their impacts be sustained over time. I'll just end by noting that a second contribution of the study was to, I think, provide a successful example of using the synthetic control method to evaluate an area level intervention. And so researchers might, want to add those methods a little bit more to their toolkit to evaluate area level public health.